Namaste everyone. Welcome to my YouTube channel. And today's our topic is amenorrhea. I am Dr. Swati Mehta. In this session, we will discuss the definition, cause, classification, diagnosis, and homeopathic management of amenorrhea. We will also study important constitutional remedies indicated in both primary and secondary amenorrhea. Before understanding amenorrhea, it is important to know the normal events of puberty. Thelarchy refers to breast development and requires estrogen. Puberty refers to the development of pubic hair and depends mainly on androgens. Menarche, which is the onset of menstruation, requires proper functioning of hypothalamus, pituitary gland, ovaries, and a normal genital outflow tract. Any disturbance in the hormone may lead to amenorrhea. Amenorrhea means the absence of menstrual periods. It can be physiological or pathological. Physiological amenorrhea occurs naturally before puberty, during pregnancy and lactation, and menopause. Pathological amenorrhea is classified as primary amenorrhea, where menstruation never begins, and secondary amenorrhea, where menstruation stops after previous occurring. Pathological amenorrhea divides into two, that is apparent and real. Apparent means concealed, also known as cryptomenorrhea. It may be a congenital or acquired, while real or revealed type of amenorrhea known as true amenorrhea, it is divided into two, that is primary and secondary. The natural cause of cryptomenorrhea, we can say, is imperforated hymen, and that is the area which is not allowing the menstrual blood to come out from the vagina. Cryptomenorrhea is a condition where menstruation occurs internally, but menstrual blood cannot escape due to an obstruction. Common causes include imperforated hymen, vaginal septum, or cervical atresia. Blood accumulates causing hematocolpus, that is collection of blood in the vagina, hematometra, collection of blood in the uterus, and sometimes hematosalpinx, that is collection of blood in the fallopian tubes. Patient present with cyclic abdominal pain, urinary retention, constipation, and pelvic mass, and the age is about 13 to 15 years, then we can consider that there may be a chances of cryptomenorrhea. So ultrasound is required, and then after there is a surgical correction and drainage is required. This picture shows imperforated hymen and a cruciate incision put on the hymen to drain out the collection of menstrual discharge inside the vagina and if there in the from the uterus. Cruciate incision having 4 flaps. So there is less, you can say little chance of fusion again, and there is no closing of the hymen, and the drainage remains as it is, and we have to call the patient for the follow-up after 1 month. Primary amenorrhea is diagnosed when a girl has not attended menstruation by age 16 despite normal secondary sexual characteristics, or by age 14 if secondary sexual development is absent. Secondary amenorrhea refers to the cessation of menstruation for 6 months or longer in a woman who previously menstruated. Hormonal disturbances are common cause of amenorrhea. This includes polycystic ovarian syndrome, premature ovarian failure, Turner syndrome, autoimmune ovarian disorders, thyroid dysfunction, and pituitary tumors. This condition interfere with normal hormonal regulation and prevent ovulation and menstruation. Functional amenorrhea may occur due to excessive exercise, emotional stress, eating disorders such as anorexia and bulimia, malnutrition, chronic disease, psychiatric illness, and certain medications. This factor disturb the hypothalamic pituitary ovarian axis and suppress menstruation. When secondary sexual characters are poorly developed, evaluation of the serum FSH level helps identify the cause. Low or normal FSH suggests hypogonadotrophic hypogonadism, whereas high FSH indicates gonadal dysgenesis or ovarian failure. MRKH syndrome accounts for approximately 15% of primary amenorrhea cases. Patients have normal female appearance and secondary sexual characteristics but lack a uterus and upper vagina. Ovarian functions remains normal and the karyotype is 46XX. These patients appears female externally and have normal breast development but absent pubic and axillary hair. Internally, the uterus is absent. The karyotypes is 46XY and testosterone level are within the male range. Treatment usually involves gonadectomy after puberty and hormones replacement therapy. Structural abnormalities such as uterine scarring, congenital absence of reproductive organs, and vaginal obstructions can cause amenorrhea. Asherman syndrome results from intrauterine adhesions commonly following curettage, caesarean section, or uterine surgery. Scar tissue prevents normal endometrial growth and menstruation. Asherman syndrome, also known as intrauterine adhesions, and it is a condition where cavity of the uterus develops scar tissues, that is adhesions. Secondary amenorrhea can result from disorders involving the brain, pituitary gland, thyroid gland, ovaries, uterus, or systemic illnesses. Common causes include stress, excessive exercise, anorexia, hypoprolactemia, thyroid disease, PCOS, premature ovarian failure, Asherman syndrome, and certain medications. CNS disorder includes stress, increased exercise levels, anorexia nervosa, head trauma, space occupying lesions. Pituitary disorder includes hyperprolactemia, prolactinemia, medications, PCOS, renal failure, hypoprolactemia, pituitary cessation, Sheehan syndrome, thyroid disorders where there is a hyperthyroidism or hypothyroidism. Ovulation disorders includes polycystic ovarian syndrome, premature ovarian failure, uterine abnormalities like Asherman syndrome, cervical stenosis, drug-induced amenorrhea like hormonal contraceptives and GnRH analogs. Clinical evaluation includes menstrual history, nutritional status, exercise habits, weight changes, medication history, and previous surgeries. Laboratory tests includes pregnancy testing, thyroid profile, FSH levels, androgen levels, and hormonal challenge test. Imaging studies such as ultrasound, CT scan, and MRI helps identify the structural abnormalities. Ultrasound is useful if the patient have never had a period and to see if all the reproductive organs are present or absent. CT scan is used to find out the cross-section views of internal structures, and MRI utilized to produce exceptionally detailed image of soft tissue within the body. Now our main topic, that is the homeopathic medicines required for amenorrhea cases, and I had treated many of the cases of amenorrhea, primary and secondary, where there is no any surgical aid is required. You can use all these medicines in your practice wherever it is indicated. Pulsatilla is one of the most frequently prescribed remedies for the amenorrhea, especially in the mild, affectionate, emotional girls who seek sympathy. Patient is thirstless, weepy, and symptoms are constantly changing. Primary amenorrhea is often seen at the puberty with delayed menstrual development. Menstruation may be suppressed after getting the feet wet. In secondary amenorrhea, there is a history of delayed, scanty, dark, clotted, and changeable menses, which is too late or scanty. There is an irregular intermittent flow. History shows that an patient is chilly with intense pain and great restlessness, which is tossing about. The patient's leukorrhea is acrid, burning, and creamy in color. Patient is having pain in back and tired feeling, and there is a diarrhea during and after menses. Pulsatilla is especially useful when menstrual suppression followed exposure to cold and damp conditions. Natrum Mur is suited to thin, anemic, reserved girls suffering from grief, disappointment, or emotional suppression. They dislike consolation and prefer solitude. Primary amenorrhea often results from anemia or debility. Due to anemia and cachexia, whether from the loss of vital fluids or because of the mental affections. Patient is having fear of dreams of robbers. Patient is sad, reserved, and there is a delightening leukorrhea replace the menses. Secondary amenorrhea may occur after emotional trauma. Menses are usually irregular or suppressed. Vaginal dryness, and because of that, patient is having painful coition and aversion to coition. There is a backache and there is weak legs. Depression. Menses are usually irregular or suppressed. It is an important remedy when menstrual suppression follows prolonged sadness and disappointment. The cause is suppressed gonorrhea too. Graphites is indicated in obese women with chronic constipation and delayed development. The patient is timid, indecisive, and emotionally sensitive. So, chronic of pulsatilla, you can say, is a graphitis in case of female complaint. Or we can say pulsatilla is at puberty and graphitis at the menopause. Menses are delayed, scanty, and often replaced by irritating leukorrhea, gushing leukorrhea of graphitis. It is aggravated before and after menses. And that is a history which we can find out in this case of secondary amenorrhea. Amenorrhea commonly follows the getting the feet wet. The same thing we can find out in pulsatilla. Patient is having history of gushing irritating leukorrhea and there is no appearance of menses at all. There is induration of ovaries and uterus and mammae. In secondary amenorrhea, we can find out the history of too scanty, pale and late menses or with there is a violent colic in epigastrium and there is itching in pudenda or vagina before menses. Patient is having constipation, irregular and delayed, and the cause again that is the getting feet wet. Morning sickness during menstruation. Patient is very weak and prostrated. Leukorrhea is very typical gushing leukorrhea, acrid excoriating leukorrhea, day and night aggravated before and after menses. That is a history we can find out. There is hoarseness and coryza, cough, sweat and morning sickness during menstruation. Mammae or the breast are swollen and hard. Nipples sore and cracked and blistered. Graphites is particularly valuable in sluggish constitution with hormonal insufficiency. Senecio Aureus is known as a female regular remedy. It is especially useful in functional amenorrhea of young girls. So where there is a hormonal disturbance and female is not having, young girl is not having amenorrhea, all the things are normal, means organs are normal and there is nothing abnormality present in the structure, we can use Senecio Aureus for the appearance of the menses. Patients complain of lumbar backache, nervousness and irritability, great drowsiness and unpleasant dreams. Sleeplessness is present, nervousness is present, the girl is very irritable, self-centered, and always there is a sensation that menses is going to appear, but it will not. In secondary amenorrhea also, the cause is functional amenorrhea, that is disturbed functions of the hormones, and that is the cause, we can find it out. There is a thick yellow leukorrhea and there is urinary disturbances are the common. It is patient always feels that menses is going to appear, but it will not. There is history of inflammatory conditions of throat before the menses, and there may be inflammatory condition of chest and bladder before menses. After menstrual commences, all these things are improved. There is a history of anemia and dysmenorrhea with urinary disturbances, and there may be a history of premature and too profuse menses. So it is highly useful in anemic girls with delayed menstruation. Cimicifuga acts strongly on the nervous system and female reproductive organs. Amenorrhea often results from emotional shock, mental stress, cold exposure, or fever. So generally this medicine is used for secondary amenorrhea, and you can find out the similarity of Cimicifuga with the Natrum Mur. The patient experienced depression, gloom, nervousness, hysteria, and ovarian pain radiating to the thighs. Menstrual irregularities are associated with severe pelvic pain and uterine atony. So atony of the uterus is also one of the cause of secondary amenorrhea. It is especially useful when psychological symptoms dominate the clinical picture. So patient is having illusions of mouse running under her chair. There is a mania that a heavy black cloud has settled all over her and envelop her head, and there is a darkness and confusion. There is a history of profuse dark coagulated offensive menses, and there is a backache and it is always irregular, and the typical pain during menses, that is pain across pelvis from hip to hip. So this is Cimicifuga, also known as Actia racemosa. Kali carb is indicated in anemic, weak, exhausted women. There is delayed menstruation occurs in the girls with chest complaint, weakness and edema. So after loss of fluids or vitality, particularly in anemic girl, there is a primary amenorrhea. Patient cannot bear to be touched, start when touched, and even so lightly, especially on the feet. Characteristic features includes severe backache, sweating, weakness and sensitive to cold. Secondary amenorrhea, the menstrual irregularities are associated with uterine weakness, hemorrhage and postpartum complaints. So patient is having amenorrhea after abortion or after labor, we can consider Kali carb. Patient feels badly weak before menstruation. There is a backache before and during menses and while walking. She feels as if she must give up and lie down. The history of profuse early menses or late and scanty menses. There is soreness about the genitals. Pain from back passed down through gluteal muscles with cutting in abdomen. Uterine hemorrhage, constant oozing after copious flow with violent backache relieved by sitting and pressure. And complaints after parturition is the causative factor of secondary amenorrhea in Kalika. So the patient feels better with warmth and pressure. We can use Kalika. Sepia is one of the greatest remedy for female hormonal disorders. It suits to women who feels emotionally indifferent, exhausted, and burdened. Primary amenorrhea occurs at puberty with yellow or greenish leukorrhea. Patient is having weeping disposition and aggravated by consolation. She is having aversion to occupation or to the family. She faints easily after getting wet from extremes of heat or cold, or riding in a carriage, or while kneeling at the church. So these are the causes of fainting in case of sepia, where in case of primary amenorrhea. Patient is greedy, miserly, indolent, does not want to do anything, and even exertion to think. So this is about the primary amenorrhea. Secondary amenorrhea is characterized by a bearing down sensation as if pelvic organs would protrude. Menstrual irregularities, that is prolapse and hormonal imbalance, are common. The famous yellow saddle across the nose and cheeks is often present. There is history of menses too late and scanty, irregular, or early and profuse, with sharp clutching pains. Patient has to sit in cross legs because of the prolapse of uterus and vagina. This disease occurs during the pregnancy, childbed, or in the lactation, and because of that, the prolapse, patient may develop secondary amenorrhea. Patient feels sensation of a ball in inner parts during menses. So wherever we find out the yellow saddle across the nose, history of prolapse, multiparity is also one of the cause of secondary amenorrhea of sepia. We can use sepia. Ferrum metallicum is especially useful in chlorotic and anemic girls. Patient flush easily despite weakness and suffer from oversensitivity. Young girl who is having pseudoplethora. Pseudoplethora means patient look like she is not anemic, but when we are estimating the hemoglobin, we can find out there is an anemia. Sanguine temperament, peevish, quarrelsome, disputive, and easily excited. Least contradiction leads to angers. So irritability is more marked. Slightest noise like crackling of papers drive her to despair. In case of secondary amenorrhea of ferrum metallicum, it is associated with anemia, weakness, ringing in the ears, and irregular menses. Menses may be profuse, prolonged, or watery. It is particularly useful when anemia is the prime cause of menstrual disturbance. Dulcamara is a valuable remedy for secondary amenorrhea, which is develops after the exposure to cold, damp weather. Menses suppressed, followed by getting the chilled or wet. Patient may become depressed, confused, irritable, and experience skin eruptions before menstruation. Symptoms aggravated in cold, damp conditions and improve with the movement. Mentally, confusion is such that cannot find the right word for anything. Patient is having difficult speech and easily becomes delirious. Patient is having sexual excitement aggravated before and after menses. Zincum metallicum is also indicated for the secondary amenorrhea in nervous exhaustion and suppressed menstrual functions. The patient is mentally dull, weak, restless, and extremely sensitive to noise. A keynote symptom is that all complaints improves when menstrual flow begins and return after the flow ceases. Restless feet and spinal weakness are highly characteristics. So always feels better every way as soon as the menses begins, and relieved all her sufferings, whatever the sufferings she is having, which is relieved during menstruation. Patient is lethargic, stupid, and sensitive to noise. Too late and scanty suppressed menses. Flow more at night. So these are the symptoms of Zincum Met. Gossypium is useful in suppressed or delayed menstruation. The patient experiences dragging pelvic pain, backache, and a constant feeling that menstruation is about to begin, but it will not appearing. Menses are usually late, scanty, and watery. It is a valuable remedy in functional amenorrhea where there is a uterine inertia or delayed menstrual onset. So to bring the menses, we are using Gossypium in mother tincture form, 10 to 15 drops in a half a cup of water 3 to 4 times a day, and as soon as the menses appears we have to stop the medicine. And I got many best, you can say best results with this Gossypium, so you can also use this medicine. In conclusion, amenorrhea is not a disease itself but a symptom indicating an underlying physiological, hormonal, structural, or functional disturbance. Accurate diagnosis is essential before selecting a remedy. Homeopathy often individualizes the treatment based on patient's constitution, mental state, and characteristic symptoms. I am thankful to you all for watching my video, and I hope this presentation has enhanced your understanding of amenorrhea and its homeopathic management. So if you like, please subscribe, like, and share my video, and wait for the other topics which I'm going to discuss with you all. Thank you.